to talk a bit about what we've been developing in the Active by Design programme and cover some of my favourite topics, health and safety and risk. I'm a step ahead of myself. We, in the Active by Design programme, work with clients to help them tackle preventable disease by creating healthy places. And by places, we mean all elements of the built environment, so buildings, streets, public spaces, parks, neighbourhoods, towns and cities. And we are trying to integrate health into everyday life and not make it an add-on. So what are healthy activities? There is a growing body of evidence on health and the physical environment. And so we draw on evidence from a whole range of different types of sources, scientific studies through to professional advice and reviews and reports. And we do also combine that with professional judgment of our own, because that evidence body isn't complete or unequivocal, and it's in the process of emerging and growing, I would say. On some topics, it's probably still a little bit crude or simplistic, but where we can draw on evidence, I think we should do so. And where that evidence plus our judgment is taking us is here. So we think that these functions are what we need to be building into our places at all scales. And when you see it written like that, it's really obvious. Physical activity, healthy food, or access to healthy food, contact with nature, and positive social contact. There's really strong evidence in relation to all of those four functions, linking them with either physical health benefits, mental health benefits, or both. And we think that we can apply these four functions to existing places, to an office, or a school, or a street, or an opportunity area, or proposals for delivering residential developments in a green belt, as many authorities, including Birmingham, are facing. So what does a healthy place look like? We think that the best way to describe a healthy place is at the scale of the neighbourhood. Walkability is really, really important. There's some evidence that doesn't necessarily all line up in relation to the one with the star, the compactness or density of places. So if we are going to be making our decisions in the built environment based on evidence, and I would suggest that we are not always doing so, but if we are going to rely on evidence more heavily, then that's probably an area that needs further research. And what we see when we look at this is that we know it already. The answers are exactly the same as what we're already advocating and trying to work towards in urbanism. So there is nothing new there whatsoever. The challenge is how to do it, of course. And I think that looking at the question of placemaking through the lens of health could potentially help us to prioritise these characteristics in a way that doesn't always happen amidst the mix of competing forces and pressures on any regeneration project or renaissance project of any size. Let's look at one of those four functions that I described a minute ago, physical activity. And physical inactivity is a massive cause of preventable disease and early death in this country. So 17% of all early deaths can be attributed to physical inactivity, which is more than smoking, high cholesterol and diabetes combined. So it's a really big killer. These are some of the diseases that physical inactivity contributes to, and these are all things that we really, really don't want to get if it can possibly be helped. So how much physical activity do people actually need? Well, about 100 or 200 minutes a week will do it. And the greatest gains for any individual are from a shift from almost no activity to 100 or 200 minutes of physical activity a week. Beyond that, the incremental benefit is pretty small. So we pay particular focus to what colleagues in public health refer to as kind of the bottom third of society in terms of affluence levels. And amongst that group, those people who who engage in the smallest amount of physical activity, bringing those people up to just a bit, just some physical activity each week, that's where the greatest potential gains are for those individuals, for society, and for the economy, not just in terms of productivity, but also in terms of the costs of treating preventable disease to the NHS. What this all points towards is walking, as I've mentioned, the kind of lowest tech way to achieve physical activity for all people across all classes and of all levels of affluence. So how well are we doing in terms of people walking as part of their everyday lives, and cycling, which is also high up the list? So this is census data from 2001 and 2011. What do people think is the percentage of people who are in work in 2001 who go to work on foot? 10%. 10? 5. 0.5. Closer to 10, 8.8%. And in 2001, what percentage of people were travelling to work by bike? 1 or 2 or 3? 1.4. And what was the shift then over the following 10 years, during which time there's quite a lot of change, certainly in Birmingham city centre? What was the direction of travel, so to speak? 2011, percentage travelling to work on foot. Any other offers? Higher, lower? The same? Bit higher? A little bit higher. And what about the change in the percentage of people travelling to work by bike? Okay. No. So I give presentations across the country and look up the local data, obviously, each time to run this little quiz. And I have to say that the Birmingham data shows the smallest shift over that 10-year period out of anywhere where I've presented. And what is stopping people from walking and cycling as part of their everyday lives? This is safety. So if we look at car travel, per billion kilometres travelled in a car in the UK in 2013, 13 people were killed or seriously injured. And it's probably easiest to use this as our baseline and to give that a risk level of 1. So what do you think the risk level is relative to that baseline of travelling 1 kilometre on foot in the UK in 2013? Higher or lower? More higher voices than lower. Any guesses? More lower voices than higher. Okay, it's 22 times more dangerous, using this measure, to be a pedestrian over a 1 kilometre distance than it is being in a car. What about travelling by bike? Higher. Yep. I think someone's seen the data. It is 50. So by this measure, it's 50 times more dangerous to travel in the UK on a bike than it is in a car. So the people who are taking responsibility for the safety of people travelling by car are probably doing quite a good job. In terms of those of us who are responsible for the safety of people travelling on foot and by bike, not really. And I think that in the built built environment, we actually have to start taking responsibility for health and safety, take ownership, and do a better job, because we can. We have the tools. There are lots of good examples there, but it's not endemic yet. Is there anyone here from Coventry? Yes, a couple of colleagues. So Coventry's made some big strides in recent years in terms of humanising the public realm in the city centre. When I was growing up there, this is the area that I grew up in the suburbs of Coventry, and in the 90s, if I press the red button, is that... And does anything happen? Is there a pointer? The red button. Okay. So this development here was delivered, a regeneration project, retail-led, also providing some entertainment for local people in the 1990s. The locals called this area Malfunction Junction. And, I mean, you guys know this isn't a great suburban environment. And looking at it through the lens of health, we can probably see that even more clearly. Home sweet home. And we know, when we look, this is a place for people who like being active outdoors. And if we were to use these 4 simple measures of health in placemaking, we might perhaps be quicker to realise that that form of development is not helpful at all, and is building in health problems for the local population. So, what should we be building? A couple of examples here of recently completed projects from around the UK. This is City Park in Bradford. The starting point for this project was not health, it was economic regeneration to make an appealing and successful, thriving city centre by introducing water, this very well detailed design. People go there. People go there on foot because they'd rather do that than staying at home watching the telly. It's more appealing, it's better. They go out there with their families, people of all different ages and backgrounds. They lark around, they go on their bikes, they have fun. This was not a warm day. But by creating the right conditions, people interact with each other. They have positive social contact. They have contact with nature, in this case water, and they engage in physical activity. This is Leicester, where in the city centre they've undertaken a series of public realm works to increase activity, make life better for pedestrians, and to reveal the heritage assets of the city centre. And you can see that, again, we're ticking the boxes. People are walking there, people of all different abilities. There is contact with nature. People behave in a very civilised manner, and they engage with each other well. They run around. They use their bikes much more than previously. And people who are frail physically or mentally, emotionally, they also feel comfortable in these places. And so that's absolutely great, because we are boosting the health of people across the whole spectrum of the demographic. All sorts of people feel very comfortable here. So, the risks of not building health into the places that we create and reshape. One risk, an economic risk, is that spending on healthcare and the treatment of preventable diseases continues to rise at an unsustainable rate. And that we continue to see a fundamental difference between life expectancy of more affluent people and more deprived communities, and that it's the same communities in the same places that suffer disproportionately from poor health and early death, and we don't think that's on. So what should we be doing? We have identified 4 areas for potential change in the business as usual approach to delivering development and reshaping places, which are these on the screen. And I think that in all of those areas, we probably have to ask ourselves some tough questions and make some quite fundamental changes if we really are going to make building health into our places the norm in this country. Thank you.